This is Chris. Chris is taking Clozapine, also known as Clozaril and some other names. Mental health medicines like Clozapine can help those with a serious mental health difficulty on their recovery journey. A serious mental health difficulty makes it very hard to manage certain feelings, thoughts, or behaviours and causes problems in everyday life. Clozapine lowers the activity of dopamine in your brain. Dopamine is a naturally occurring chemical that carries messages between brain cells. It helps you to regulate your thoughts, emotions, behaviour, and perceptions. Chris is taking Clozapine, having tried 2 other similar medicines that didn't work very well, but it can also be used if you found the side effects of at least 2 other medicines too distressing or uncomfortable. Clozapine is the best medicine at helping with hearing or seeing things that aren't there, having intrusive and distressing thoughts, strongly believing things you usually don't, or feeling agitated, very excited, or elated. On starting Clozapine, it took 2 to 4 weeks to build up to the right dose and for Chris to notice symptoms improving. The full effects of the medicine kept building over the next 3 months to 1 year. During this time, Chris noticed some side effects. Side effects are more common on starting Clozapine, which is why the dose is started low and built up slowly. Some side effects may get better as you continue the medicine. Some may not, but there are lots of ways to make you more comfortable. If you are worried about side effects or feel the medicine isn't helping, your doctor can make changes to find the right fit for you. With Clozapine, most people who take it report that despite the side effects, they still prefer it to other medicines because it works best. The most common side effects of Clozapine include drowsiness, dizziness, racing heart, muscle jerks, drooling, blurred vision, constipation, and increased appetite. There are some physical health tests you will need to have before starting Clozapine and during your treatment. These tests will check for side effects to make sure any unwanted changes are found and managed early. They include blood tests to count your blood cells and to check how your body handles sugar and fats, weight and body mass index measurements, and a heart check. The blood tests for your blood count will be repeated every week to start, and then less often as you keep taking the medicine. You will only need a blood test every 4 weeks after a year of treatment with Clozapine. There are some other things Chris thinks you should know about Clozapine. Don't stop taking Clozapine suddenly. Your doctor will be able to advise you on the best way to stop the medicine. It's also important to tell your doctor if you've missed more than 2 days of medicine, as you will need to restart at a lower dose and build back up again. It's a good idea to take Clozapine at the same time each day. Chris takes it twice a day, in the morning and at night. To have the best chance of staying well and out of hospital, you may decide to take Clozapine for many years. The level of Clozapine in your body can change if you stop or take up smoking. It's important to tell your doctor if your smoking status changes so they can adjust your dose. Clozapine is not available in all pharmacies. You will get your medicine from the same service that does your blood test. If you notice that you have constipation that isn't getting better, fever, sore throat or flu-like symptoms, or chest pain with a very fast heartbeat, it's important to speak to your doctor straight away. For more information on Clozapine, you can speak to your doctor, nurse, or pharmacist, or read the patient information leaflet. If you want to save the important information from this video, take a screenshot now. This video was co-produced by a group of pharmacists, doctors, nurses, and young people for youthmed.info.